Hello, my name is Melissa Shessler. I am a registered nurse in Atlanta, Georgia. I've been a public health nurse for 2 years, and I'm a former NICU nurse. Today I'll be discussing nurse residency programs and how they can help alleviate some problems within hospitals. Hospitals today are facing several problems, including decreased insurance reimbursement. Healthcare policies are continually changing, and hospitals are now receiving less reimbursement from insurance companies. Hospitals used to be paid a set amount based on the services provided. Now that amount paid can change based on things like patient satisfaction and nurse documentation. While it is good that hospitals are being forced to scrutinize their policies and improve patient safety, hospitals are generally receiving less funding and are being forced to cut budgets. Hospitals are also being affected by the nursing shortage. By the year 2020, it is predicted that the U.S. will need 1 million RNs to fill the vacancies. As the population ages, more nurses will be needed as the demand for healthcare rises, and the aging population means that a lot of nurses are and will be retiring, which will also affect staff supply. Nurses are also choosing to get out of the profession due to the demanding hours, high stress, and mediocre wages, and nurse turnover is a huge expense for hospitals. One way hospitals try to cut budgets is by lowering the cost of their main expense, which is nurse salaries. They often do this by freezing salaries and hiring new graduate nurses instead of the experienced nurses to fill the gap since they are able to pay them less. The problem is that hospitals expect these new graduates to carry the same load as the experienced nurses, though this jeopardizes the safety of the patients. Research has shown that it takes a new graduate at least a year before she is competent in a role, and nursing schools often focus more on theory and book work and less on the clinical skills they'll need in the hospital. New graduates often lack confidence, have trouble organizing, have difficulty completing assessments and interpreting lab values, and often have difficulty communicating with doctors, their patients, and coworkers. Unrealistic expectations of new graduates put patient satisfaction and safety at risk, which can also affect hospital reimbursement. It can also lead to a high percentage of new graduate turnover due to the new grads not being able to transition into their new professional role. And nurse turnover is a large hospital expense, so hospitals really need to focus on retaining these new graduates in order to reduce their costs. The Institute of Medicine addressed these hospital issues during its Future of Nursing brief in 2010. The Institute of Medicine recommended that hospitals develop nurse residency programs to help alleviate these problems. These programs help transition graduate nurses from school to profession and further develop the skills needed to deliver the safe patient care. The Institute of Medicine recommends that these programs be funded by sources such as the hospitals, Medicare, Medicaid, and by using diploma program funds. Nurse residency programs are programs initiated by hospitals for new graduates to help them transition into their new role. They generally last between 3 months and a year, and graduates are assigned a preceptor who reports to the new graduate's progress to the nurse manager, and changes are made as needed. These programs usually begin with a hospital-wide orientation, but sometimes they have the opportunity for new graduates to rotate throughout the different units in the hospital. They also have educational lectures, skill training, and critical thinking scenarios. These activities help new graduates become more competent and confident with patient care. There are several benefits of nurse residency programs, including improving nurse satisfaction, nurse competency, and patient safety. Research has shown nurses have increased job satisfaction, reduced stress, more confidence, felt more supported, and were better able to fit into their unit after participating in a residency program. Nurses were also eager to start the residency and felt pride in their hospital. This caused a decline in graduate nurse turnover, which is a common problem throughout hospitals. One of the greatest benefits of nurse residency programs is that they increase nurse competency. While some skills are learned in nursing school, many do not have the opportunity to practice them until they are employed in the hospital. In residency programs, skills are reviewed and practiced in a small group setting, and research has shown that nurses have more confidence, competence, and are better at organization, prioritization, and communication following the residency. As nurse competency increases, so does patient safety. Hospitals are increasingly shortening the orientation period for new nurses in order to cut costs, but this jeopardizes patient safety because a new nurse might not be able to perform the skills adequately or recognize a patient status change and need for intervention. Nurse residency programs have been shown to improve patient safety, as well as increase nurse performance and productivity, which also reduce costs for the hospitals. Research has also shown that they increase patient satisfaction and corresponds to increased hospital reimbursement from Medicaid and Medicare. While residency programs can cost hospitals between $21,000 and $37,000 per nurse, the benefits greatly outweigh the costs. Residency programs decrease new graduate turnover, which generally costs the hospital between $22,000 and $77,000 per nurse. A decrease in turnover means the hospitals will save money by not needing to pay for as much overtime or contract labor. Residency programs also decrease the amount of time it takes for a new graduate to reach 90% productivity, which also reduces costs. Patient satisfaction also increases, thus increasing insurance reimbursement, which further increases the hospital's return on investment in the residency programs. In conclusion, nurse residency programs can help hospitals solve many of the problems they are facing. While the cost to initiate the program is significant, hospitals will actually save money in the long run by implementing them and increase patient safety and satisfaction, which is priceless. Thank you, and I hope you enjoyed my presentation.